you give us the clinical thinking that it should be. We shouldn't go through and a specific line to pass. You can see the other part of the exam, and we are human in our nature. And I now understand that even when we are talking, there may some mistakes happen in the exam. The same mistakes may happen, but you should know how to handle during the exam. I remember in my exam, that was a scenario: patient coming 2 hours to 2 hours travel to come to the clinic, and then in the scenario mentioned it was Friday afternoon.
Oh, and that typical.
Oh yeah. And my exam was Wednesday afternoon, so by mistake I said that okay, so tomorrow I can see you to have a review, and then the examiner said that tomorrow is Saturday, and I was thinking, oh, it's Wednesday afternoon. So I don't know, we're Wednesday afternoon, and she looked to the like the board. Oh no, it's like
She's
Friday.
trying to hint and prompt you.
And I thought, oh sorry, I just my mind got confused. Sorry, yes, we're like a Friday afternoon, so still we're open on Saturday morning. So if you can come and I see you, it will be a good review.
Oh, so you still said like, oh yeah, it's Saturday, but still I'm.
It's Saturday, but we're open. But we're open. Our practice are open, so we can have a review.
Open on Saturdays.
And she was okay with it. I mean, even in the communication, some mistakes can happen.
Correct.
But
because as like the point that you're saying is actually really important. And you said it before the camera started rolling, like you were thinking as a clinician when you were preparing at the beginning, but then you started affecting from all the voices outside and candidates, which they have their own experiences, and you became robotic.
Yes.
You became scriptic, and you started saying things that don't make any sense.
Yes.
But when you came back to a clinician, and a clinician makes mistakes.
Yes.
They get confused
We're human.
sometimes.
We're human.
Exactly. Wednesday to Saturday. So rather than panicking, I said Saturday instead of Wednesday. Now I'm going to fail. You said, oh, I'm so sorry, I got confused, but I'm still open on Saturday. Or I'm happy to still open on Saturday to see you if it's something urgent. So like a clinician.
I really want to say that examiners really acting like a patient. And when you go to exam,
hear it very well. They really, really are patients.
Yes,
they're not examiners. They're patients.
I remember I told the examiner about fluoride. She was acting like she never had the fluoride word. So they were acting very well. So when you go to the room, you can be a real clinician and think that this is the real patient in front of you, because they are acting very well. You should act very well.
Yes.
But
well, for you, it's not going to be really acting. It's genuinely coming from a place of, I'm a clinician. It's my patient today.
Yes.
They've told me that I'm seeing someone who has caries or who has pain, and I'm literally, how can I help you today? Or I can see here, I've just done the exam. Tell me more about that. Clinician.
That's it.
You don't have to act empty. They're acting as patients, but you are not acting. Be a dentist that understands Australian guidelines and communicate well.
Yes. And as I said, they are searching for a whole thing in you, not like just giving them some points that you know the information, all the information needed for that scenario or case. They are searching that, are you going to empathy with the patient? Do you have enough information? Empathy to the patient. Do you care about the patient? Do you understand the patient's perspective? Do you see that when they change their face, you should change your tones, or you should understand? Did they understand what you are talking about? Because dentistry is a kind of very specialized thing, like
it's
a very specific
art and science.
Yes. So it's some part, it's like the thing that you do with your hand, the technical part. But the other part is that, can you really communicate good with the patient? Is that enough? And I think the most important thing is that we should talk as simple as possible.
There's something called the KISS method. Have you ever heard of it?
No.
So I hope that you guys remember it. So we say kiss it. keep it stupidly simple.
Yes, yes, that's the
kiss
main
it.
thing. That's the main thing. Even for example, when you're talking simple, they
Yeah.
are really going to their patient mood and they are
Yes.
keeping it simple. But if you brought up something very complex,
Oh,
like,
they will play with that. They will
Wow,
drag you.
yeah,
You're like,
yeah.
you wanna play?
okay, come
I
on.
can play.
I remember one of the candidates talking about occlusion. Occlusion is a
Oh,
really hard
yeah.
subject, even with dentists. So you bring it up with an
When
examiner,
they read the
they
word
twist you.
pathophysiology in the rubrics, and then they start. So you have 3 layers, and it's called cementum and dentine, and there's dentinal tubules. And
Yes.
oh my God, why are you saying?
Are you talking really to a patient like this?
Exactly.
Patient are not,
they don't care
here.
about dentinal
Yeah,
tubules.
yeah.
They care about sensitivity.
Yes.
And what are you going to do about it?
Yes. Yes, exactly.
And when you came to us, like you came actually like 1 month before exam, right? Was it one?
Yeah.
Like roughly
1.5. Yeah.
And then in terms of your OSCE, for your OSCE communication, the first part of your role plays were like
Yeah, it wasn't.
the points,
Yeah,
the checklist,
the
rubrics.
checklist, because I was thinking that way, and I was thinking in the hardest way possible.
Yeah.
I remember that when I'm saying that I was like thinking hard. I remember with the scenario of the patient having pain with the root canal. It was the first thing that I told patient. Maybe there is like an infection. No. Maybe there is high spot. The first thing is the high spot.
Yeah.
Now
Going from the most probable to the
here
least likely.
helped me, yes, to go back to the clinical thing that I was thinking
Yes.
previously.
Yes.
And I think it is very important.
Yeah.
For that, I like my experience with the communication, but the skilled OSCE, I don't know, may other candidates believe or not, but the 5-day course was really even more than enough. That was really good.
The foundations.
Yes, the skilled OSCE course. The mock was a genuine experience that put you in an exam position. I remember in my mock day with the skill OSCE, I don't want to stress. I didn't want to stress myself. It was like a mock for me. Okay, let's go do for it. And I remember like our examiners was acting really tough examiners, and they made the situation very hard for us.
Very well.
Yeah, and I was like, I had heartbeat after that. But
we actually get into like, we really do get into an examiner mode. Like
yes,
we get somebody asking, saying, oh, can I ask you about something, or can I get your feedback? And I'm like, this is an exam.
Yes.
Don't talk. We're not going to be talking
to you. You didn't talk, no laugh, no smile, nothing. That was like a hard experience, but it's a good experience because when you go to your real exam, you know what's happening and what should you do exactly. And when you're under the pressure of time and exam, everything can change. I didn't have some mistakes in my practices that I had, but
you had it in your mock.
But I had in my mock.
Yeah, because once you add the stress, and you add the time management, and you add the same simulated environment, what you don't do in your normal practice, even in the center, there's no pressure or stress. It all shows on the mock day. So why do you want to risk that and go straight to the exam?
To the exam, yes.
Get all the mistakes and all the stress out.
And it sticks to your mind for always.
Because there's an emotional response to it.
Yeah.
Any information that has an emotional response, it actually, from a neuroscience perspective, it actually locks it in. That's why there are certain things. Let's say you had one of the best meals you have ever eaten in your life, and you remember it till this day. But then, do you remember every single meal you eat every single day? No, because in that experience, it had an emotional tie. So that's kind of like the similarities in what we put, that simulated environment.
Yeah.
So I prefer actually that you fail our mocks.
I think everybody will fail your mocks.
You're right.
But that's a good, that's a good thing, because even the small things matter. Here, I remember exactly what was the reason I failed in my marks.
Yeah.
One of them was my hair was like this, and in the exam I just tied it back. This,
Yes.
as simple as
Simple,
this.
yes, yes.
As simple as
Infection
this.
control.
Infection control.
By the way, I actually want to add this to your the skilled OSCE, because you mentioned, you said on day one we took the infection control and it was so overwhelming.
Yes.
But then day 1, day 2, day 3, it started making sense. Do you know how many people fail infection control, the cluster, and they fail the whole exam because of skilled OSCE? And they say, oh, skilled OSCE is just 4 tasks in a big cluster. You fail your infection control
because of the skilled
because of the skilled OSCE.
Yes. Yes, and I remember to practice myself with the infection control, even at home, I was washing my hands with all the things in the 40 minutes so that it becomes like
habit.
It becomes like a habit. Yeah. Then in the exam, I was like doing all the things in a routine. Yes. And it helps with your confidence as well. When you go there, you're not looking overwhelmed, okay, what was the next step? What should I do the next? And even in front of the examiner, you look like a real practitioner.
The attitude actually in that, and we use it all the time. I know I didn't say it in your course that time, I wasn't there, but we actually talk about habit building, and we say that when somebody is under stress,
yes,
they revert back to their natural habits.
Yeah.
So if you haven't wired yourself in this new habit and doing it again and again, that's what we focus on, the courses and the mocks and that simulate environment. In the exam,
yes,
if you have to think, you lost it.
Yeah.
Because it's 10 minutes.
10 minutes like flies.
Goes like that. And then you've got an examiner breathing your neck. You lose it, you go back to your natural habit. So what you have done is like, you're the perfect student. That's why you passed from first attempt. Like, there's no surprise there.
No, I think the problem is that maybe the people didn't get ADC, what really ADC was.
Yes.
If they understood it, they can pass it. And the most important thing is the rubrics. You should understand the rubrics very correct, what they want from you.
The rubrics, which takes us actually to technicals.
Yes. And like, for example, when they say straight line access in the endodontic cavity, they don't mean straight line access. You should understand that it's
90 degree with the ruler.
It should be like this, but it's still straight.
Yeah.
Or even, for example, what are the specific points that they want from you? For example, with the tooth selection, you get the point. Every candidate get the point.
Yes.
But what are the real competition? What you should like think about it more or do more jobs on it.
Yes.
This is the things that we should know.
Understanding. So that's such an important point, which you noticed it. Like in the technicals, it's not, oh, it's just a supervised session. We literally sit down with every single rubric, and until you understand what does the rubric mean? What's a critical error? What's a point you can get, so you have to get? What's a point that is so difficult to get?
What are the easy points that you can get?
How you said, like, I felt my work was good at the end, and you guys kept telling me, no, not enough. You have to do it more, because we have to push. We have to get the highest points ever. On the day of exam, you have to make decision making. What is it that is a critical error that I have to fix? And what is, it's okay, but if I fix,
that can be much better.
Can be much better or much worse. So maybe better to stop and not do it. Because on the day of exam, like, I'm just going to remove the whole restoration and do it again, and there's like half an hour left. That's so risky, and some people will end up losing. So it's those decision making, the rubrics, the time management. You even said, like, I had no time on day of exam.
Yes, that was the other thing, especially with the people who are going for their first attempt, because we're not aware where the other like stuffs, where is the clean area, I mean where the like the DA area, or where is the amalgamator, what should I do, till the time that you feel that and you look around, it's like half an hour passed from your exam. Till you go to the DA and get the stuff that you need, all these things. And
I call it like an alien universe. It's got another time.
And you don't know, wow, I didn't do anything yet. It's just passed. And there was another thing I remember. I wanted to go with the endo task. and I was too much stressed because I didn't have enough time to finish my exam. My hand was shaking like this. Well, I couldn't do like an endodontic axis cavities like very. You should be very like good with that. And so yeah,
Which tooth did you have for your endo?
1/6.
Oh, okay.
It was 1/6, but it was, I think it was a good.
It was a good tooth.
Yeah, thank God. So
You had the PFM molar, so like
yes,
you
yes,
needed a break.
yes,
Yeah.
really, it was like that. So from different perspective, I recommend here because give you the clinical thinking that you should have as a clinician, and I should put aside that you really have a friendly environment here. Everybody is friendly here, want to give you the best feedback and whatever they know about the exam and their own experiences, and they want to show you that you shouldn't give up. And especially thanks to Afnar. She
gets a mention.
yeah. No, she told me to not to give up, and I was always remember her sentence till the last day. So the other thing is that the course length, specifically with the skill OSCE, that I know that others are like just 1 day, but 5 days is really good for a skill OSCE because the skill OSCE is still a part of the exam.
Yeah.
And we should pay attention to it. Some people
And we
may
talked
underestimate
about the
it.
infection control cluster.
Yes, some people might underestimate it because they think that it's just a little part of it. It's just at 4 stations. Then it's not going to be very important. But practicing it make a habit for you.
Yes.
And like having this course here in Prep Doctors gives us the opportunity to practice. Like for example, when you have 2 tasks to practice in a day, that gives you a better idea and better habit. What should you do rather than doing 10 tasks in 1 day?
Yep. Massive overload of information and then not
Yes.
enough practice, not enough understanding. Okay, you have the slides, you read, but this is a performance-based exam.
Yes.
You have to perform and
show yourself as a clinician, which is confident enough to do that. There is no need to think. Yes.
That's why specifically skilled OSCE and OSCE communication, they're assessing you on the spot. It's attitude. OSCE is all about attitude and performance. And now we've clearly said skilled OSCE, it's not just those 4 tasks within one cluster. Infection control is a cluster by itself, and literally you can fail that and fail the whole exam. And I appreciate you saying about like a friendly environment and a supportive environment, because that's very, very important. I have said it many times and I kind of like it, so I'm going to say it again. I said, you know, this academy it's built by candidates, by ADC candidates, for ADC candidates. Like we've all been through the process.
Yeah,
we've all had those sleepless nights. We've all had the self-doubt. We've all
we all
spent so much
all
money
have
and
gone
time.
through these process. So you actually understand how a candidate feel during each step of the exam. And also one more thing regarding the technical part is that my hand actually was good even before starting the exam.
I remember I saw in your couple of first sessions, your hand is good.
Yeah, you told me. But the thing is that you need some tips and tricks, little things that even when your hand is good, it makes it much better to fit with the exam criteria. And especially, even if we put this one aside, the other thing is that some little tricks can help you with the speed as well, so that you can have your time management timing in the exam as well.
Points.
Yes.
Increasing collecting points.
Yes, that's the other thing. Even I just mean that even with the people who have the good hand in dentistry, they may need the course.
Yeah, and that's why I said, you know, we have advisors. We advise which best course would be. Skilled OSCE Foundation, we tell everyone. We said, I don't care how many times you've done the exam. I don't care how many courses you've done outside. You need to go through the Skilled OSCE Foundation period. But with the technicals, it depends you might need a week, you might need the full proper 3-week and then 4-week
Or
of
even a boot camp.
support. The boot camp, yeah.
Yes.
So we will never push something on you that we don't believe. It's like, we don't just, oh, everybody buy the boot. No, you might need it, you might not need it. So
Yes.
that's why we have advisors. You know, book a call, we'll advise you. I told you, if you live in Sydney or Melbourne, book something where you can bring your work. We can have a look at your work and then advise you what we believe the best service
Yes.
is for you.
Yes. All in all, it's a tricky exam, but exciting.
And it's not impossible.
And it's not impossible. Yeah, it's really
From
not
a mindset
impossible.
of a winner like you, where till the very last minute, have the support of your guide and your teachers, and I'm
trust
very
yourself.
grateful that, absolutely. I always say it's three T's to success, which is 3 trusts. You're gonna have to trust yourself. You have to believe in yourself that this is actually possible, and that attitude of come from the place of confidence.
Yes.
Trust your guide. So if you, let's say, pick us, trust us, trust that we know the process, trust that we know how to get you there, and we work together. And then the last T, because no one knows what will happen, is trust in God, trust in the higher power, surrender and let it go. If it's meant to be, it's up to me. You do your part.
You do your job, and then the rest will be there.
Congratulations.
Thank you so much.
Thank you so much for coming and visiting.
Thank you. I was very happy with my experience with you guys and become familiar with you. It was like having a new family for me as well. And now I'm over the moon.
Yeah. Well, now on to your next chapter. For those who are still in this chapter, I really look forward to seeing you here, talking to you somewhere, even seeing you eventually in conferences when you become dentists yourselves in Australia. Remember, you are already a dentist. Good luck, and
thank you.
Good luck for you too.
And good luck for all candidates.